VITEG as part 2 of our ongoing stakeholder engagement. My name is David Darm, and I'm going to hand it over to Ree and Mary to kind of lead this discussion. But again, just to kind of reiterate, we had a really great discussion, I think, as a start. Lots of good feedback, lots of great feedback on the WebEx. We again understand that there were a lot of technical issues, so we do want to have this again. This is not a one and done kind of conversation. There were also some folks that we tried to recruit for the steering committee, if you will, who could not make it here today. So we will do our best to reach out to those folks and give them a summary, and then bring them to the next time we meet. So with that, I will turn over to Ree and Mary. Any housekeeping I need to cover before you want to just dive right in? No, and I think we'll do at one point. Maybe we're going to start with introductions, or okay. I'll go ahead and pass it around. I do have a list of folks so I'll go down and just see if those are not here. I'll make mention that they were supposed to be a part of this discussion, and so.
Hello, I'm Paula Arnold from the ARC Big Bend.
Suzanne Sewell, Florida ARL. We represent provider agencies across the state of Florida. Many of them provide ADT and support employment services.
Denise Pilgrim from PARC in St. Petersburg, Florida.
Kirk Hall, the ARC of Florida.
Sue Cabot, Florida Developmental Disabilities Council.
Amanda Baker, Florida Developmental Disabilities Council.
Rachel Siegel McLaughlin, Senior Staff Attorney with Disability Rights Florida.
Heather Service with Vocational Rehabilitation.
Jan Pierce, Vocational Rehabilitation.
Caitlin Flannery, Pine Castle, Jacksonville, Florida.
Michelle Johnson, Pine Castle. I'm the Program Director at the day program.
Carrie Bates, ARC of Putnam County. We do have ADT supported employment and supported living.
Joelle Neary, The Angelus. We do have an ADT.
Eunice Leckie, APD CMS Specialist for the Northwest Region.
I'm Sheila Britt Swift with the Florida Developmental Disabilities Council.
Chris Perez, AD in Miami. AD Inc., Helena Belmonte, CEO. We do adult day training, support and employment, companion.
And hello again, Ree Kennedy Lizette.
And Mary Sowers with NASDs.
I'm Elizabeth. I'm the WebEx person.
I'm Lindsay, and I work with David here in Central Office.
And my name's Kalima Muhammad, and I'm with APD.
So all along in my head, I've had that this is a beginning work group, and David and I've gone back and forth and calling it a focus group or a work group. Focus group usually have more discussion. But I'm going to challenge us to think of ourselves today as the work group that's going to really help strategize and put things in play. So if we could think about it, you've all been invited to do that. I did create a couple more slides just to guide the conversation, but before I start, sort of thoughts from anyone on what you had expected for this afternoon? And it's okay that there were no expectations. I mean, that's okay too. Hello. Susan.
Hey, thank you. Represent provider agencies who provide adult day training and support employment. We help folks, who obviously are going to be impacted by this change. And, as I keep saying, I think everyone wants what's best for the individuals and the clients. Obviously, there's concern about, oh my goodness, what's happening to ADT? We're going to wipe it out. Our primary concern is we never take away something to fund something else that may be the priority for the time. So how do we holistically meet the needs of folks and whatever those needs are and whatever their choice options are? And then what needs to happen with this system to achieve those goals? I think if everyone comes away feeling like that is truly what we're working on, then there should be buy-in, everybody wanting to work together. I just hope we don't find ourselves in, oh, that's no good anymore, we're not funding it anymore, now we're going to look at something new and different that could change 10 years down the road too. So those would be my comments.
Anyone else?
After lunch quiet time. Okay. Please, it's Amanda.
So one of the big trends that I have seen since I've been doing advocacy work is, we have all these programs now to get people in employment, but I think we're missing the piece that helps people keep their jobs. So I think we're doing a really good job of helping people get a job. And I mean, I know it's not perfect for everyone yet, but I think we're excelling in that part. But are people keeping their job past 90 days, past 6 months? Because I don't think we have the capacity yet to keep people in their jobs and sustained in their jobs because of all the issues that happen once you start working.
Right. Okay. Thank you. So really, this is an open discussion. We're going to talk about defining processes that turn the planning and the high-level HCBS transition plan into implementation. And that takes actions, that takes setting benchmark objectives. So we have to think about what is the ultimate goal. And I hear you loud and clear, Susan, that in every state, not just in Florida, we have to think about how do we not ruin or disrupt some of the stuff that needs to continue to happen. It's not black and white that we can turn a switch on and off every day. We have to stay focused on that brass ring. I keep referencing that because that's what it is. And so I just want to remind us of that you've been invited to be part of helping APD make decisions on the actual implementation. Not just to talk about what's working and not working, though that's important, but be part of doing action steps that get to implementation. We do need to talk about the boundaries of risk-taking, and we'll get to that. I will remind us of that. So next slide. So our task is really about, this morning we talked about barriers a bit, but really staying focused on what might be part of the solution. We're going to this is brainstorm time, guys. What if kind of conversations are what we need to have here today. What if we did this? Does APD need to do this within the structure of a pilot so they can stretch beyond some of the challenges around compliance and mandates from the federal government? I mean, maybe, maybe not. It takes a lot. So you're oh, very good. Kalima invited me to stretch, so here we go. APD really means it. They know that this is stuff that not just APD, but ARCA here in Florida, the Medicaid agency, needs to take into consideration. I'm going to share with you some strategies and ideas that other states have done to help spur the conversation about what if we did this or that here in Florida to start moving the needle to a new place. So we're not going to answer these questions now, but I want to put them in your brains to think about. How can we as a community increase employment for all people with developmental disabilities? And we as a community are those of us at this table and everyone else in Florida. This is a big picture question. And then I want to challenge you to think about what each of you could do from the role and the perspective that you come to the table from. In your role as a provider, as a family member, as an individual, what could you bring to the table or do to help move things forward? And then beyond employment, we need to think about community engagement. And I was debating about a handout, so since we've talked so much about the adult training programs here, and how to rethink and challenge some of your thought around how do you move that part of the culture of the system here in Florida. So it was very apparent to me in this morning's conversation and just in the attendance that that's an area that is in high demand attention here that we need to focus on. So how do we help those programs that have been designed as caretaking, as David said earlier, medical model structures to really break out into the world of supporting people to have an everyday life? And what is that like? And what are the pieces that you have to put in place? Not just the funding, but the staff development and the business infrastructure at the provider level. And certainly larger providers in the state are going to have a little more flexibility in the manipulation of funding. Those of you that are smaller organizations, that makes you hold your breath and say a lot of prayers around because it's not as easy. So let's take a minute and talk about what are those things here, because we did see in the data that you do have folks that are working in getting other life supports from the ADT service structure here. Can some of you talk about what is working about that? How is VOC Rehab involved in that or not? I'll get.
One of the brightest things we've seen is the proviso language for ACA to amend the Medicaid state plan for the working adults with disabilities provision, which drastically increases the amount of earnings that individuals who are on our budget waiver can now earn. We need more and more of that type of approach. That's huge.
Do you think people around Florida know that yet, or is that so new that it's not out there in the field?
That's new. That's still rolling out, but yeah.
That is, we're going to really capture all of these thoughts here today because, as Reed mentioned, it's all brain power. But one of the things too that sometimes even thinking about an eligibility change like that can have profound impacts on individuals' lives. But Medicaid eligibility isn't for the faint of heart, and so trying to figure out how do you make really get the word out in a way that folks can really grab onto becomes the inherent challenge. So it's wonderful that that's happening, but I think this group helping APD really get the word out to folks is great.
I'd like to make a point of that because we had invited our family care council membership to be a part of this discussion, but unfortunately for travel, the folks that we wanted to serve on this group were not able to make it here. So I'm hoping in the future they can be able to weigh in on this topic. But as I understand, our chief of staff mentioned to me that they had discussed this at their last Florida Family Care Council meeting, this Working People with Disabilities program, and that it's generating a lot of interest amongst our family advocate organizations because that has been cited as a significant barrier, is the concern that when somebody goes to work, what will be the impact on their benefits. So I think I'm really glad that Suzanne brought that up because that being a new initiative will be something we should consider the impact going forward as far as this discussion goes too.
And
I was just going to say, and Amanda raised this great point too, that it tends to be, especially there are a lot of myths and misperceptions, and this isn't just Florida specific, across the country about, when folks have those benefit cliffs and where those pieces are. So it certainly ties into that messaging. So thanks for that, David.
And if we want to move and advance employment as a whole, when we have legislation like this, which allows for additional hours of employment, that's really the time where we need to be able to look very hard at the data parts to see what the actual reduction is in those services being delivered, and then be able to target those specific reductions of service for employment related. So as people work more, that time that's saved goes to efforts to help people work more rather than taking it arbitrarily from a group of people who are already receiving services, so that we're using employment to move employment along, obviously. And in order to do that, we need to have a real capable way of looking at that data to know how the services are being reduced. One of the things I would hate to see as a result of additional employment is that reduction in service because of coordination issues, and that they still need those supports, but now because they're working, they're just not able to get them or access them. And so are the cost savings we're seeing a result of the fact that they're working and they're doing better and they're healthier? Are they a result of other factors? And be able to really take a holistic look at what this means for individuals as we move forward.
So does Florida have that data yet? Do you have a way to collect it or know it?
That would be a great question for David and Kalima.
I guess.
we definitely are.
Okay, so I failed to mention this because of the time this morning. I do have a coffee cup. I don't know where it is. It says, if you torture the data long enough, it will confess. So I'm sure we could torture it to find that answer. Let me understand your question. So you're saying we can look at the reduction of other services potentially linked to whether somebody is reported employed.
So the critical part of that is being able to track the employment piece of it and the service piece by individual, so that as those numbers change, you're able then to effectively know how that is impacting the person, and in planning, strategically plan for those reductions to be targeted to individuals for employment purposes. If there's a formula-based system we could use, we could actually see individuals come off the wait list for other services too. You could proportion it out so that there's a beneficial impact overall through employment, and it's not just one or the other. But that requires a laser focus on what's happening by service, by individual, across the board. And that can be, I know, daunting for any organization.
Possible, yeah.
All things are possible in data.
I can't answer that now, but I think that you're raising a really good point, and I'll look into see what we can do with that as part of our discussion going into the future, because we have been looking at the impact on what does employment have on the cost of total waiver services, because that is a part of the conversation always. I think someone mentioned earlier about potential cost savings. If somebody's employed, they spend less on the waiver. But what you're talking about, it sounds like it's much more specifically pinpointing those services and the impact on it. So I'm noting it because, like I said, I'll go find ways to torture that data and see if we can find those answers.
I was just going to say, because what I have to say kind of goes along with what he just said. And it's looking at the whole person and the services they need and how it changes, because when the services you need when you first start working are not the same services you're going to need in 6 months or a year. It doesn't mean you're not going to need any services. But I think a lot of times, I know when I started working, my job coach got me a job, and they were able to say they got me a job, and it was kind of my starter job because we all have that first job, but they kind of just left me in that job and weren't helping me look for another job. And so there's that. And then part of the reason why I went into benefits planning is because I had one session with a benefits planner when I got my first job. Well, 5 years later, when I moved from part-time to full-time, you know, I needed another visit with a planner, and you know, people are having to wait 6 months or a year for benefits planning services, and a lot of times agencies only offer it like once you already have a job. You need to talk to a benefits planner before you get a job, after you get a job, every 6 months after you start working, because I mean, from personal experience, when I started working full time, I lost my Medicaid and waiver services within months, and I lost it for a year, and I was, you know, by myself alone trying to figure it all out. So that should never happen.
Agreed. That's one of those, what we've learned in other states. And what if Florida added that component to the expectation of support employment follow-along services, that it had a built-in expectation in the service delivery that it was about financial management? Because there's a difference between what you learn from a benefits counselor versus financial literacy and financial management over time. Because you need that. We all need that. Yeah. Right. You have to know how to maneuver that within the system, for sure. I think that is one of the things families need help with understanding too, very much. So, did this person want to say something? Oh. Family Care of Palm Beach City is on the line. Jean in Malacca. So, Jean, let us know when you want to jump into the conversation, please.
Okay. As we move forward with trying to, and I don't even know if this is the word, demedicalize some of our services, that certainly is going to be somewhat of a challenge because, of course, that is about changing the culture. And one of the words that we keep using here is bringing the community and getting the community buy-in. One of the most critical elements of our buy-in has to be our school system, because they are the ones that is the net for for a lot of our people, you know, especially the transition age youth that I focus on. We have to have that school system buy-in. One of the things that we're going to be doing this summer, and one of the things that we did door-to-door with our schools. It's not enough to send them an email. It's not enough to send them a notice. It's to actually get in the face of ESC directors district-wide, to get in the face of the teachers, those people who are developing those IEPs. And we have to make sure that they're not putting together template IEPs that one size fit all. And that when possible, I know that VR has some of their representatives at the table with IEPs, you know, and I mean, that's not something that APD has really been involved in.
What if APD staff and VOC Rehab staff partnered and went to those schools together?
Well, we've really begun to bridge that relationship, and we're doing a lot of interfacing as it relates to when an individual comes to VR that perhaps qualifies for our service, immediately they connect them with us. If it is a person that is already connected with us, we make sure that continuum of service continues after VR finishes that phase one. So there is a lot more development going on as it relates to our communication with VR at this time.
So that's something that's working. You're finding that when that connection is jointly made together, that helps education move the system forward. So let's keep that in mind, because as you build the procedures and processes and expectations going forward, is that something you build into as a standard practice? I could tell you an example of a state, Colorado, their VOC Rehab and their DD agency and their mental health agency, every other year do round robin training sessions with local communities, and leadership from each of those state agencies go together in front of folks and train together in front of folks. And that joint messaging helps bring together what I heard earlier, how many times families say, I think, Amanda, it was you that brought up, you hear this from VR, you hear that from school, you hear this from someone else. What Colorado has discovered in doing that, although it's an incredible amount of work for the state level staff, it has paid off in tenfold the value for them, because people are hearing the same message from multiple agencies, and they start understanding the linkages and using each other. So something that would, if Florida did that kind of practice on a regular basis, would that be something that would help you with your transition strategy?
VR and APD went around the state and did training sessions in every single area. Now I've lost track of time, 5 years ago, maybe a little bit longer. And we heard that same feedback. This was aimed at the mutual staff, VR and APD staff. And we heard such positive response, and that people were saying, VR's in the room, APD's in the room, the message is the same, and one's not saying, well, you should do that, and the other's saying, well, the other agency should. And we did a consolidated training, and something like that I think was just very valuable.
So what would it take here to put that back into motion on a more regular, consistent basis?
A lot of planning, and you're developing a lot of resources. I mean, we stayed on the road, not consecutive days, but for a couple months period of time, because we wanted everybody to get the message fairly consistently, and it was sheerly focused on supported employment.
Sure.
Just going back to the whole IEP, the individual educational planning component, during the last State Advisory Council for the Education of Exceptional Children, that's been coming up with regards to self-advocacy curriculum. You know, DOE has their Stand Up For Me curriculum. It's one of those educational components. But the kind of that critical conversation around it was that as part of a statewide IEP process, families and students needed to have access to the resources that were available to them. And because that's not being communicated by individuals who are being taxed to go through 20 meetings and get through it. Yeah, everybody has to get there because they're looking for the signature at the end of the day, and they're looking at the educational requirements, and that is rather than what's going to happen tomorrow for that person. And to me, that's the most critical part of the IEP, and everything else should fall from that. There are those post-secondary goals, whether they're education, employment, or some combination thereof. And so really advocating for that educational part to be part of a statewide process. And that, again, is going to wind up in the hands of our Department of Education folks when they're doing templates and developing those kinds of structures for people to benefit from.
In a number of states, support coordinators that work in the adult systems become involved and start attending IEP meetings around the age of transition, you know, ideally 14, but sometimes later. I was just wondering, does that happen with regularity here in Florida?
It does in pockets, and that's the problem. We have pockets where those relationships are strong. We have pockets where people work well together, and then we have everything else. And we have the vocal parents who make sure absolutely that my child's taken care of, and then you have others who rely on the educators and the agency folks to give that information. And if that person doesn't see it for that individual, they don't push that agenda. And so if we're not including some general information as part of that process, and we can't necessarily have an agency person there for every IEP meeting across the board. I know there's a resource limitation. Then we have to make sure the tools are sufficient to at least touch on this early and often.
I know for us at a smaller level, our case managers are working diligently with the schools and getting into the schools and introducing ourselves at an early time, sometimes middle school and right as individuals start high school, and getting in there and talking about APD and talking about VOC Rehab and getting the ball rolling. That's working for us, not at a large scale, but at a small scale, it's working for us, and we're getting people to, whether they have services with us or not. We're not marketing our services. We're marketing the services available before you graduate. What should you be doing? So that has worked for us at a smaller scale, getting more involved with the school and the county.
Mr. Dean can hear us. Trying to make sure you can hear us, Dean. So do you have the VOC Rehab staff that are doing the pre-employment pre-EPS kind of activities with you?
We do. We have our CCIR that's coming out, and we've had a lot of results. We've got some good results from that as well. We are using the CCR training that's coming out on an annual basis, and from that, people are getting involved with VOC Rehab and Phase 1 and Phase 2.
Help me, what do you mean by CCR training? Oh, that's how you're doing that formal. Got it. I'll get that by the end of the day.
But that's been successful for us for streamlining some people that normally would not get all the information regarding VOC Rehab out there. So that's been successful.
So Kim Lotus has been messaging us, and I just wanted to relay her message to everyone in regards to having VR and APD being invited into the IEP meetings with the schools. So she said that it's already supposed to be happening, but she does hear from the families and the individuals that she serves that it's similar to what has already been said. It's not happening across the state, and so she's in rural Northwest Florida. And she also thinks that we're all waiting too late to instill the idea of employment first, and that to have IEP meetings as the provider invited, and at the meetings with the ESE specialists to talk to those individuals. And she is representing middle schools. I'm not sure what her provider agency is. Oh, I'm sorry. She's an agency provider. I misread.
I think the other thing, sticking with schools for a minute, and I think that where I come from, the schools for a very long time now have done a pretty good job in terms of bringing work experiences into the high school level and then the 18 to 22. It's a big county and a big system, and I think they've had a lot of expertise in this area. But I think the key really is making sure that students are settled in work sites and have very specific skills that will allow them to maintain that work, not just the work itself, but all the soft skills that go along with it. Because I think what happens with families, I think if they see their children being successful in work experiences, they're going to want work experiences for their children. If they don't see them in those kinds of situations, that doesn't become part of their vision of what their child can do necessarily. So I think it's really important to get the schools more engaged with their communities in terms of developing those relationships with employers, getting the students out on site, even, with the supervision that the school system provides, so that afterwards the thought is that they should be working.
Yeah. So in thinking about that, what do you think APD and this work group could do to assure those work experiences and that information is competently and comfortably, if that's a word to use here, I don't know, but that's part of how it happens automatically. What would it take? Is it a business process? Is it a mandate? I mean, and I'm one of those people that is cautious about too much mandate. I think mandates to me, are best if they're parameters so that there's flexibility in between. But is there something that we as a group could do to assure that on a more regular basis?
So in our county, we have a Children's Services Council, which is a penny sales tax funded group that provides all kinds of services to children, either with disabilities or at risk. And they have a transition subcommittee, which, really brings together all the people in the community that are working on transition. And there are family members, but also the schools and VR and the agencies that serve adults and, all of those people engaged. And I think they do a transition conference. And I think that raises the awareness of the families. It's for the students and their families. But I think that in terms of the businesses, it has to be a community approach. And I think you've got to go out and, get your Chamber of Commerces and your Rotary groups and, all the connectors that have access and power over the resources that would be possible sites. So I think that's really important.
And I was just going to add, when we're looking at, since the advent of WIOA, VR is spending approximately $29 million on pre-employment transition services, hitting youth 14 and above. So we ventured into a territory where we've not our traditional VR, and have really focused on work experiences and all of those opportunities for youth so that they do have those successes early and families do see that there is, opportunities. And so while that is still, and we're trying to get resources out to the school and send our counselors out more frequently and have those relationships. So even if we can't be, because it's just not possible with the number of students in the state of Florida for us to be at every meeting, but we've asked them to let us know when they are so we can send information, and if there's special needs that we need to be there, we do our best. But there's different ways that we're working on in this new world of getting information out most effectively and efficiently. But we're really focused on those youth so that they can, as they become adults, they will have had 3, 5, or more work experiences and will have gained all sorts of skills, both work skills as well as those necessary soft skills that we talk about. And so that trend will continue. We are going to continue to provide those services. And I think that will be of great help as we talk about work and employment, because I hope those youth are going to make other decisions about what they want in life based on those positive experiences.
Absolutely. I'm going to piggyback on what Jan said, and we're working very hard to continue to build the relationships with the schools. We have great provider relationships with our provider community that help us serve youth, but we're also diversifying the ways that we work with schools so that they can continue to serve the students directly. So we have a lot of different options for the way that we can do work-based learning experiences for those transition youth, and some of that is directly with the school. And so we're working really hard to improve those partnerships and to diversify the options that schools have to work with us, because it's not only, serving those students on an individual level, it's really working hard on building relationships, showing successes, and working with the other school districts that maybe haven't tried or taken that leap of faith and showing what can work and what we can do. And we're working on that together. I think some of the difficulties we've had are those points of handoff where there might be a transition with a counselor from VR leaving or a school district representative leaving. And one of the focuses that we've been working really hard with is working with our DOE and BE's partners to firm up those relationships at the district level and the VR area leadership level so that when there is a handoff or there is turnover, we have a plan in place so that we're able to continue the services. So we are really working hard on solidifying that so that we can continue to serve the youth that we need to be successful. Pass the mic.
I do think that VR, APD, and others, Employment First, there's been a lot of focus and initiative, and I think we're communicating the message well that individuals with disabilities can work, want to work, and so I think that tons of progress, have been made there, and I compliment the agencies for working on that and moving along. I think where we run into a problem is once youth folks are out there ready, okay, I want to work, where's my job? We just don't have the supports. Starting, we mentioned transportation and, the job coach or whatever. So if we can bridge, we've created, I think, the public education and the, hey, folks do want to work and, employ people and, we're here to help, and people get jobs and do what we can. Somehow we've got to provide the supports that people need because otherwise our efforts at communicating and preparing people are going to fall short.
Is somebody else talking yet? Again, on the note of poor communication, and I'm going to start very early in the system. And I know that the school system does a lot and VR and all of us as professionals do a lot. But you'd be surprised how many parents, once their sons or daughters reach 21, 22, will knock at our door hoping for services and they've never been enrolled in APD. They don't understand the wait list. And frankly, if information were to get around, I don't know what the legislative body will do because the 20,000 persons in waiting list right now would be 10 times a higher number. That's a very, very big problem.
And I can tell you that the word is getting around now because we are doing in this area, the Northwest region, and that is because we are doing a lot of door-to-door, and we are doing early intervention, and we're making even the daycare centers in the elementary schools. Last week I was in elementary schools passing out packets saying, hey, listen, these are our application for services. These are the disabilities we serve. If you see these students early on, we need them registered with us. We don't need to wait until these families are in crisis, and now we're trying to get them eligible for services while they're in the midst of a crisis. We don't want that. So we are doing a lot of outreach in this region, and I also want to just say a little bit more about the school system. For sure, as the agencies, we've really got to be intentional because these schools are really expanding their services. They're starting to do credentialing. And when that begins to happen, you're going to have students who are really looking to us to get them work.
No doubt about it.
Yes. We have TCC who's starting their credentialing program. And we have the ACE transition program out there. I mean, most of you know about the ACE program, especially VR. And they're constantly producing people who are ready to work.
So how can APD and VOC Rehab, I do believe you have your MOU in place, or not? No, still working on it. Okay. You want to talk about that?
For me to talk about it. We are in the process of working with VR right now. We did have a data sharing agreement, but we realized that it was not really doing, it was not filtering down, like at the state level, we have something in place, but that wasn't always necessarily the case in all our regions. Just like we talked about earlier, there's pockets of our state where there is good information sharing. We have some of our regional staff who have really great relationships established with their VR counselors and supervisors. Others are struggling. And so I'm working with Jan and her team. We're actually meeting with them next week to look at that process, because it's not just data sharing. We also want to look at how do we track folks who are going to be referred to VR, that they don't get dropped in the system. This is a big concern, particularly for those folks who are receiving the career counseling information referral when they want to seek out VR services. What's the follow-up from our side that we could do to identify these individuals? And then for VR to let us know that these individuals are, have an application in the works, that they are working on an IPE, if they've been approved for the service. There's lots of different pieces that we want to be able to address, but it really starts, I think, with really narrowing down what that process is going to look like. So we are still working that piece out, but hopefully in the next month or so we can have a little more information as knowing where each of our agencies want to kind of go with that process.
Okay. I just wanted to add on, and we may get to this in a little bit, but I think the school system stuff, I do see bones of that coming together in my short 3 years I've been doing this. I go to IEP meetings a lot because there is not an APD office or VR office in Putnam County. So oftentimes the ARC is looked at as the one-stop shop for all things, and we become just an advocacy organization for helping people understand what's out there. With that said, I see all of that happening, and although it's messy right now, I can see us working through some of that. I am more concerned with the 120 people that I serve in my day program with an average age of 55 who have not been plugged into that system, may not have had the benefit of formal education and the intense level of training that they will need. And I think the ADT is the perfect place for that. It's structured in that way. But, I mean, they are going to need a lot of training, life skills, job skills, social skills, all of that. And some of them, we serve quite a bit of medically fragile people, people with G-tubes. It's a huge social piece for them. And they're living longer and all of that. So that is more of a concern for me because I see how the youth is going to come together. VR is instrumental in all that, and I see that happening. I worry about everyone else.
And that was right in line with, except you did a wonderful job. I would have done, I will do much worse by comparison. With that ADT and that work experience, when we're looking at supported employment and ways that we can make those adjustments, we know that work experience and those activities, those skills need to be developed. We need to include that as part of our supported employment model. And for the adults, we have some mechanisms in place for the youth, but you have adults who haven't had that opportunity, haven't been exposed to the community in that way, haven't had access to employers. We know that it works. What's working? Those work-based learning experiences, those things are working. It helps mitigate the family's fears because they see the impact on their child, and it puts our individuals in front of employers so the employer can understand. One of the comments from this morning, I say one, there were several, that they have difficulty navigating that employer piece because employers aren't interested in, they don't see how that person can work within their business, within their organization. And this is the mechanism to do that, to give them that in a way that's not going to produce fear for the family, it's not going to produce fear for the employer as far as taking that opportunity because it's an experience. It's not the actual work, but that's what leads to the actual employment.
I want to say a couple things. I think that in terms of what's working, the project search models have been working really well with the, school age group. I'd like to see something like that in place for those who are post-school age. And And the other thing I think,
well, everyone's
Yes.
chuckling because that's one of those things that absolutely has to start happening here in Florida, and other states have figured out how to do it within waiver structures. So we'll
there you go.
we'll put it in place.
The other thing I think is a little interesting are some of the more entrepreneurial, where parents are really kind of taking the lead. Like we have Rising Tide Car Wash in our area, which was a car wash, and now there's a second one that was developed by a father of a child with autism, and the child loved cars, and he was thinking about what he could do, and so opened a car wash, and now he's got like 40-something people with autism working in the 2 car washes. So I think that, I have a friend who started the Chocolate Spectrum. They were making candy in her kitchen, and now she's got a little cafe and a bakery and still selling the chocolates and employing, again, a number of people. She has a son. And the son was very difficult. He wasn't like an easy son. He was a hard behavioral, low functioning son. And she's got this great business going. And I think that also is part of, it takes a special parent to do that. But I think that if we can find ways to kind of encourage and maybe incentivize those kinds of solutions too.
So that's a good reminder that all options should be on the table if we're talking about making sure people have their individual choices respected. So how does APD and VOC Rehab work together to reinforce business development by an individual or a family? And how do we support that? And what do we categorize that under the service delivery structures? You certainly can do it under individual employment. It's just one option. And remembering not every option works for everybody, but having those in place takes a lot of infrastructure, especially in the Medicaid world, I will tell you that. And I know VOC Rehab too. They can't be hobby businesses. They have to be real businesses if we're going to support them from Medicaid or VOC Rehab money. That means formal business plans and putting in the processes and procedures to make sure those are accounted for.
Can I?
Yes, please.
Part of what I do in my business is go to IEP meetings for families that don't have a support coordinator, that don't have a VR counselor, who just don't really know what their rights are, or what they're afraid to ask the school for stuff because they don't really know what they can ask for. And I can tell you that the expectation for someone that's in special ed classes versus the person that has DD that might be in regular classes is completely different. And we really need to not only educate the families and the individuals, but also the people that work in the field, that have been in the field for so many years and maybe just don't have that expectation that that person can do things because it's the way it's always been done. And, we're still over here in this classroom away from everyone. And because that's still happening. I came from Panama City, so this is, and it was building 13. It made me think of file 13. I'm like, these kids are in this building, and, it just drove me crazy. And I'm college educated. I'm very smart. And I can do a lot of things, but I still had challenges to traditional employment, and I had to go the self-employment route. So if I have challenges, but we have to, people's mindsets are just not where they need to be. They're still in 30 years ago when people just didn't have that expectation of employment at all.
So it certainly sounds like from this morning's conversations and this conversation that some really attention and work needs to be done around messaging and communication. That sounds like it's going to be one of your major tasks here to address that. To do that, it's going to take all of you to figure out how you talk with each other and come together with a central message that regardless of what agency you're coming from, the message is the same to build that culture and expectation. You are going to have to talk to doctors and the medical professions, and you're going to have to talk to early intervention folks and families that come through the system from that door, just about what is possible in life and hold those up. So, but it's sounding like that is going to be one of those priorities of putting together a strategy to actually put out some major communication pieces, ongoing and meeting and all of that. I want to shift us for a few minutes.
I'm sorry. I would probably forget what I was going to say if we moved on. But along the lines of the communication, I think one thing to keep in mind is everything is not the same. I'm from Madison. It's a very small rural area. It's the culture of the community is even different from Tallahassee, and in Madison County and in Suwannee County, a lot of our parents don't want their children to work. They're afraid. They're afraid for them to be in the workplace, and they're afraid that they will lose their benefits. They don't understand what it means. We do the summer camps, the summer VR camps. We were not able to do a camp in Suwannee County last year because we marketed the camps as being work readiness training. And when the parents who had been gung-ho about their students attending these camps, when they saw the flyer, they said, oh no, we don't want our children to be taught that they should go to work. That's not what we want for them. And so I don't think they understand. And also I attended, a couple of years ago, I attended a parent meeting at the school where they talked about the special diploma. And I don't know a lot about it. I've only been in this field for a year and a half. So when I went to that, I was doing that on a consulting basis. But the parents and the students in that room, they felt like their student was going to go to FSU and be a pediatrician and these type of things. And the ESE's teachers and the staff that were there, they kind of promulgated that. And they acted like that was okay, and that was a great goal for that student. And I'm not saying that everybody shouldn't have dreams, but if your student is in high school getting a special diploma, they're probably not going to end up at FSU in medical school.
Save that thought. It is something we have to talk about in how we think and change the culture of expectation, because just because someone has that dream doesn't mean we shouldn't let them try. They could be doing something entirely different within that structure of that dream and meet their dream job. They could. Well, I'm not so sure about that. I would challenge you that maybe there is. I have worked with folks with special diplomas, though I hate that. I will tell you. That have been able to get into jobs that required a high school diploma in the past minimally. Even in federal jobs, we have made accommodations through I hate that word special, but accommodated hiring practices to help people find or carve out or customize a position within the context of that dream. So there are possibilities. So we can't let ourselves get stuck in that place that because they have a special diploma or that's the track they've always been on, that they're probably not going to get there. We cannot ever crush people's dreams.
But we need to be realistic. And if you're going to be able to do this, here are the things that are required to do that.
And we have to teach them experiences.
Right.
Absolutely.
And possibly move to something else within that. Because this is kind of one of my pet peeves, and it happened with my own child, is that when children say, oh, I want to be a doctor or a lawyer or a policeman, everybody says, oh, good, that's so good. And then the kid goes on this path, and they may or may not have the skills and abilities and really even the desire to do that thing. They just think it sounds good and everybody else thought it sounded good, so they went with it. So I'm not saying they shouldn't have their dreams and that we shouldn't help them meet their dreams and strive for their goals, for their own personal full potential. But I'm just saying we shouldn't mislead them into, going along a path that we know is not going to end up where they want to be.
One of the things, and it might be something that this group takes a look at, our association that Rhea and I work with partner with the University of Missouri at Kansas City around an effort called the Supporting Families Community of Practice, and it's really about the tools are called Charting the Life Course tools, and some of them are so wonderful in helping individuals and families just sort of define what a good life looks like for them, and sort of all the things that would help them get closer to that good life, and then all the things that might take away from that. And so I'd encourage, I know Florida's not actively participating, but the tools are available and are certainly, I think, could really spur some conversations and are wonderful complements to person-centered planning practices. So, to the extent that even as the states that are involved tend to try to engage early intervention, or things that can start to set those expectations early, just to begin to think about how to make a good life for someone, not a service life. So many times in our systems, we inadvertently or directly drive folks to that service life, rather than thinking about the supports that can really complement and buffer the individual in a way that helps them really engage with the community and not create a layer in between them. So that just might be something this focus group, as you guys start to tackle, get down to brass tacks, there might be some tools there that can help you think through. It's also a great tool for our systems to use. So what's a vision for a good system? And I think you've outlined some of those pieces here today too. So
I think that's the next exercise. Let's talk a little bit about some ideas that other states have put in place that could help spur some thinking here in Florida that you might try as mechanisms or structures. So Wisconsin's a state that works within a managed care structure. And this is how they're working on shifting attention to employment first and giving some incentives to the system. Now, because they're managed care, in their structure, those managed care entities get a per person payment. That means all their services are combined in one payment, and then the MCOs negotiate what those specific services were. So what they were able to do is put in place this year that for their payment to their MCOs, and then the MCOs can decide whether they're putting it to their provider networks, which some are, some aren't, is to withhold some of the full payment. And if they make a goal, they have to set a goal. So given whatever they're at with the number of people they're providing supports to, they help them achieve employment. They set that percentage agreement with the state. The state then gives them their full payment. And if they exceed that number of people that have actually become employed, they get an extra bonus on. It's a financial incentive to move the system. So we're seeing that kind of incentive payment or alternative payment happening within the context of Medicaid HCBS services. Well, I do. The question was, how do you prevent cherry picking so that it's only people that could probably easily get a job on their own? Well, they, in their action, so every MCO had to develop an action plan, and the state tracks all those, so they have acuity levels of how they track what funding. Part of their performance plan is that they touch every acuity level. So every group of persons part of the improvement has to occur for each part of the population. Should I articulate that clear enough? I probably didn't. how they just significance of their disability. Yes, thank you, David. So, well, in their agreement for these performance improvement plans, that the state already knows in their allocation of money how many people each MCO supports in each of those different level of need areas. So I can't tell you exactly how many are fall into which category. So you might have a community that has 50 people that fall into the high need category, 50 that don't. So you'd split that you have to make your performance standard in each area. So that's how they've done it in practice. And they have the data system to be able to track that minutely. You can't do that kind of infrastructure unless you have very clear individual data collection. Thank you, Kurt, for mentioning that earlier. That is one of the things that your state is going to come to the reality of needing. And individual data, not just unemployment, but outcomes for when we support people, what is now your traditional ADT programs. It's a challenging infrastructure piece to put in place, but it's doable. And there are states that have been able to get there. You do it incrementally. It's easy to be clear about what's the outcome of employment. I'm presuming we talk about competitive integrated employment at the individual job level. I have a bias, obviously, about that, and so does the Workforce Act.
One question. Supposing a similar model would come to Florida, would a managed care system come under APD, or is this supplanting APD?
So, although I think, yeah, well, and one thing to be clear, and I suspect there are other examples here, Wisconsin, while they happen to be a managed care infrastructure, other states are also looking at ways to pay for outcomes in a different way than just regular fee-for-service models, and so really trying to drive those purchasing strategies that are trying to alternative payment models. So you're not just buying units of service, but you're really paying for the outcomes for folks. So I think the example of Wisconsin doesn't belie that you have to have a managed care environment in which to have this operate. There are states that are exploring opportunities within the fee-for-service environment and how to do that. The important piece, as Ree mentioned, and thanks, Kurt, again, is really figuring, in order to understand the outcomes you're achieving, is really getting a clear picture of what your current state is, what your as-is is, sorry for the redundancy, and being able to be very clear about how you measure it. In our HCBS, these are payment models that are emerging across the country, and they tend to be an easier thing in clinical, in Medicaid, and if the hip replacement is successful, and there are usually a finite number of folks who have a hand in making that happen. But we know that many folks and many contingencies touch the lives of the folks that we support, and so really thinking about all the different pieces and players that have to be considered as you're thinking about alternative payments. So I know that there's interest in our members nationally just around how to pay for various outcomes. So certainly not a managed care doesn't have to be in place in order to achieve.
Thank you for the explanation, but because what concerns me, and maybe it's my lack of understanding about the managed care system, but I do understand that there is a level of managing the managed care that comes with a number, and I would not want that number to be sacrificed out of the already limited budget for our consumers for services. That concerns me a lot, and I can see a very similar system to be in place under the APD if they just give a stipend incentive to those supported employment providers that are reaching better limits than others. So
yeah, that's what this example is about. It's an example of managed care or not, an alternative payment that would incentivize shifts in the system.
My concern with a managed care system and moving into kind of a medical model is that many of our services that are needed aren't by definition considered medically necessary. And there's potential pitfalls when moving in a system like this, that language like that creeps in, and then all of a sudden you have a provider who's got their per rate amount, and they're really incentivized to only provide those very services that they absolutely have to in order to generate that cost savings and then move individuals along, because now they're not getting this, so what do they have access to? And I don't want to see our people out of desperation be moved into a system of service. Do you follow my thought process?
I do. I'm sorry we went down that path of managed care. One of the things that's open discussion here is that we're going to talk about pros and cons, the good and the bad, the hard conversations we need to have. So I appreciate you guys just joining in that, and some will make all of us cringe at one point or another that we think, oh my God, let's not do that here in Florida.
Yeah, for the purpose of this conversation, we know that there's like the boogeyman in the room. You know how some presentations you have the elephant in the room. Sometimes the boogeyman in the room for us is managed care. And, you know, it's one of those things that it's working in Wisconsin. That's not the system. We're fee for service. However, one of the things that came up several times this morning was the rate structure, the cost, and that type of thing. We have limited money, and we've done a good job of spending over what we have. So we want to be able to do this redesign in a way that providers are incentivized to make the changes that need to be made. And so in the back of our minds, we understand the money thing. We're just trying to figure out what other options and what's working in other states. And so if we can glean something from Wisconsin, even though we're strictly fee for service, then let's do that. Let's not recreate the wheel in a system that's different from ours, because we have talked to Rhea and Mary about alternative payment framework, which we look at fee for service and look at quality indicators and paying based on achieving outcomes and those types of things, because there are different structures out there. But I want to just leave the boogeyman in the corner and move on to New York. And if anything else says MCO, we're just going to ignore those.
Totally didn't. You know, Kalima, I know that boogeyman in here in Florida. I should not have made that the first slide. Yeah. It's an incentive payment, and it's a way to do that, and it's an option that is on the table within HCBS services. So something to think about. So New York is an example. Now, all this is about how states are taking it from their HCBS formal transition plans, what they've told CMS they're going to do, and now how do they move it to the next phase of operationalizing things, which is where you're at. You have to take what you've declared you're going to do and how you're going to operationalize it. New York, and it's not the only state, but many states now have closed the option within their Medicaid waiver structures for new admissions to pre-VOC services. That's all your structure is just rehabilitation, so it's not as clear as it would be in New York. But that said, you do have far more ADT facility-based programs in the state than you will need in 3 and 5 years from now. So to get to your point, Susan, how do you, and I'm sorry, I forgot your name, about how do you move the system forward when in ADT you have so many folks that are 50 years and older? That's a really important thing to think about. So you don't want so many new young folks coming in as people move out to other services, but also what do you do with folks that have no other life experiences?
I'm glad that was brought up. Actually, I think when we did our analysis of our individuals in the ADT across the state, I think the average age was in the 42, 43, and we also found that we also looked at employment trends, that the positive outcomes that seemed to be, they would just raise as they got older to about 44, peak, and then it would go down each year. So I do like that, because there is such an emphasis focused on the youth, which is important, but for a lot of the folks that we're talking about who we serve, many of them are in their 40s, late 30s to the early 50s that we also need to focus on. So.
How are you defining sheltered workshops? I'm trying to figure out, is an ADT a sheltered workshop? Is a sheltered workshop where you're only working earning sub-minimum wages? So what are we talking about when you use that?
In New York and in most of the country, sheltered workshop is a facility-based employment where work is brought into a facility of workers with primarily disabilities, and they're paid sub-minimum wages. That's what I mean. I do recognize, or we do recognize here in Florida, that your your day training centers fall under what is called in the Medicaid world day habilitation. And technically, I will expose you all to this, you should not be operating or paying anybody wages in those settings. Well, yeah, that's true, but you have to fix that.
Sorry, Mike, and this will probably need to come after your question because I think yours is probably focused more on that. Can you give some examples of some of the businesses that are approved in this model? Because I'm curious as to how they're transitioning away from what they were doing prior to and what things were approved under that system. But I know that's a next step for this conversation.
So like you have your primary adult training facilities, New York had more what are the typical sheltered workshop settings where most of their services were delivered in that kind of service type. I'm sorry that I'm not turning my back. So that was their biggest challenge. They had to do something with that. CMS, because they were under a plan of correction because of some of their multiple issues, CMS said to them, you've got to stop funding anything in a sheltered workshop environment by I think it was 2010, but the state actually didn't do it till 2011. So they were, in order to continue receiving home and community-based federal funding, they had no choice but to stop it. So what they did is create this 25 organizations now that do a secondary business, and they're in transition from this. And they actually had to use state-only money for the transition. So you don't have much of that left in Florida to even play with. So, but New York's a different state and has different options. So what they did is created a mechanism that their traditional sheltered employment or those facility-based employment that were paying sub-minimum wages had to stop paying sub-minimum wages. They had to become a subsidiary business to the provider organization. And within 2 years, they have to be a standalone viable business model that does contracted employment for all of their workers and at least 50% of the worker population have to be people without disabilities. So they become what is often referred to as affirmative industry, where they're a social enterprise business, and not a service provider business. Now, they're still working through this. This was an option for them to consider because they had such volume of people in their facility-based work programs that were earning sub-minimum wages. So that's how they're doing it. None of those right now are standalone businesses, but they had to create separate boards of directors, separate administrative staff. So it is like a subsidiary business.
And the reason I ask is that kind of transition is just a huge undertaking, and obviously, so given that this is one of those things that another state's doing, I was very curious about the potential for them to be self-sustaining by the time frame that they've. Anyway,
we're all wondering that too. Time will tell. Time will tell. Remember, this is a time where we're talking about, what if we tried this? What if this could work? And if we don't try it, how will we know? It's sort of like the experiences we all have. If we don't try things, we don't know if they're going to work or not. New York is trying this as an option. So I'm just putting it out there as, this is something unique a state is doing. And we have to watch how it's playing out. I can tell you that their provider association was part of designing the structure of it for the state. And they agreed, let's give it a shot. Otherwise, all this shuts down tomorrow because we will not receive federal funding if we don't figure this out.
And this is not a question, this is more a statement than anything, but I'm going to talk as a parent, and I'm not a parent because I never had any kids. They are my sons and daughters. I have been with ABE. This year will be 40 years. And as a concerned parent, today I will be the voice. I have so many questions in my head because as a parent, I do want the majority of my consumers to be employed, to be totally aces in the system and to have a life of their own and to be fully independent. And many of them are. We just had one of our consumers in supported employment graduate after how many years? Retire after.
He was worked in a cafeteria in a Dade County public school system for, I want to say, about 25 years.
So we have many success stories, and we must push for those success stories. But then I'm concerned for that segment of our population, whether we want to admit it or not, they will always need a program. And I am concerned about them. What do? Are we going to name the ADTs a different terminology? Because frankly, ADT means nothing nowadays with what we are providing for our consumers. If we are truly following the tools and the protocols, we are far greater than an adult day training, which always gets confused with adult day centers, which is really services for the seniors. So we're doing much more than that, but still, I have many consumers that I can tell you the barriers. Number one, choice. They don't want to be employed. Number two, the negativity of the families. And especially, in Miami, of course, we have a lot of the Hispanic population and, they don't want to, exactly. And, also those consumers that, basically they don't have the environmental adaptabilities no matter how much we want to truly integrate them. I have tremendous behavioral focused consumers. And yes, our population is, thank God to medical science, growing older, and that's wonderful. We started a silver program. Now we have a different curriculum for 55 and older. So maybe those are the different things, but a lot of the ADT providers right now, I know, and many that are on the phone listening, they must be so concerned, so we need to have a lot of gray area in this before we think that all consumers are going to be employed. Because for one, I am one of the ones that I think that theory is beautiful in theory, but it's not going to be totally in practice.
I think it's interesting you say that, and I am totally with you. The general population of people in this country, working age adults, not everybody works. We are not a country that declares all working age population should be at full employment. We should not expect anything different. But we can't, we are at such a point in time where people are not employed that could be employed and should be employed, that we have to promote employment first and keep it out there at front and center. We have never said, or should we presume, everyone's going to be employed. That's just not how the work works. But if we let go of saying, okay, those folks, these are the folks that don't have to work or shouldn't have to work, or we shouldn't have that expectation, we're going to leave people out that we don't know.
I don't know, and we may get to this a little later, but I heard this morning a little bit of talk about like the small group employment model, and I know that's not the goal. The goal is, but I guess for me, if we're talking something that works, that oftentimes is how we can start the conversations with the families, because they feel very comfortable. A staff's going to be with them at all times. The idea is they eventually graduate on and maybe get hired on. So I don't know if we have any time to talk about that, but I do think that that is a model that we have had a lot of success with, and some people have gone on to complete either supported or not independent employment. But it is a great pathway, just like we all kind of need pathways. I think it is part of that, and there should be some room for that.
I'd like to say one more thing.
I was going to say it, and I want to say this, that I respect all of you guys that do ADT, so please don't take anything I'm saying offensively. But just like in the population without DD, you're going to have people, we're fighting against mindsets that are so many hundreds of years old. The mindset has been, my child can't work. If I work, I lose my benefits. If I work, I'll lose this. And I'm sorry, but if you have, there are plenty of people who have adult children who just don't want to work. Does that mean that they shouldn't work? No. It just means that they've had everything handed to them, and they've had mom to do their laundry every day and their parents to pay their bills, and they have a nice, cushy little life. And I'm not saying that that's everybody, okay, so please don't hate me, but I'm just saying there's a lot of people out there that haven't had to work and haven't had to take responsibility for themselves. It's about time that they did.
Thank you for saying that. Reminding all of us.
Thank you so much for saying that. Rhea and I had a recent experience with someone in Maryland, actually, who had made some pretty dramatic changes to the way that he provides services and supports to individuals. And he was someone that, as the conversation started, and the catalyst was a lot to do with the HCBS regulation, but as the conversation started, he could give you 1,000 reasons from sundown why many of the folks that he supported couldn't work. He's in a particularly rural area in the state, and there's not a lot of jobs in the community. Well, within a year's time, I don't know what the epiphany was or how but they have gotten jobs for 70% of the folks that had previously been served in his setting. And I think that what really helped was the approach of helping to support one person at a time and figuring things out for one person at a time. And it's just that notion of setting these expectations and really trying to, and not presuming that there's a one-size-fits-all solution for folks, really trying to come up with individualized solutions. And even with different types of jobs that maybe work for that person, and making sure that it wasn't work it's only work, but instead it's, employment, the other supports are critically important to wrap around the individual too. So I only share that story because it was someone who, if Lee and I had to bet a year ago that he would do a total 180 on the types of supports and be someone who's kind of a champion for opportunities, it really has been quite a remarkable turnaround. And I just share that story because I think really he made the epiphany of you've got to take it for one person at a time, and unfortunately it can be sometimes tempting to say, oh, that group of people by some measure can't work, and it's really important to remember that we're all individuals. So. Yes, both. It's really individualized.
Thank you, because we have some folks who we have folks who go to our ADT and they would like to have a job, and the feeling from all of the people involved in their life is that probably wouldn't be possible on a 20 hours, or anything. But these same folks, we have developed avenues for them where they can go for an hour or 2 hours a week, and they make minimum wage. And when they get their check on payday, they are thrilled to death because they have work and they have a check. And I will just say, and I'll add to your story. I told you I was new at this. When I first started, the first week as executive director at the Arc Big Bend, we hired a gentleman to work at the rest areas, and so I went in and met with him, and I said, we favor persons with disabilities, and he said, well, I have all kinds of disabilities, and he began to tell me all of the things that were wrong with him, and he was hired, and I hate to admit it, but I come from government background, in case you couldn't guess, but I told my husband that night, I said, probably in any other business, that man would not have been hired, because he just had too many disabilities. There's worker comp issues. There's all this stuff to worry about, But, we've hired him. I want y'all to know about a month later, he came in. It was payday, and I said, how's it going? And he said, it's going wonderful. I got to do something yesterday. I said, oh, okay. And he says, every day I go in, and I'm supposed to clean the bathrooms and mop and wipe the sinks. And he said, I do it. But he said, the guy before me has already done it, to tell you the truth. And when I get there, it's really already clean. But I go ahead and clean it anyway. But he said, I don't enjoy it because it's already clean. But yesterday, when I got in, the toilet was stopped up, and I unstopped the toilet, and I cleaned everything up, and then the visitors were allowed to go in, and they had a nice place to go, and I accomplished something. And he was thrilled with that, and that sort of made me started seeing things from a different perspective.
Thank you for sharing that. That is what it's all about.
Yeah.
I want to get to one more thing. So it might be a couple slides. I'm realizing we have 15 minutes of time that we've committed. Pennsylvania for a minute. One of the things Pennsylvania has done, and there's, with all the states, there's pros and cons. Could it work in your state? Could it not? They created a new array of service types, like you suggested, so everything's not all lumped under AD, your adult training program, which I really think would be helpful for you here in Florida. It would help to show what you actually have accomplished and give you more measurable benchmarks. So they have changed their service options. They have limited that new people can't access traditional services, so that they go down a different path if they're new in their system. They are very much focused on employment first. That doesn't mean employment only or employment all, but it means first and foremost, do we have an expectation of you to consider this? and try it before you make a decision and experience it. But the challenge in implementing what they did, the percentage change. So as of this year, anyone that had previously been full day in a facility only kind of program, they have to be out and about 75% of the time. Community inclusion. They're a year or a year and a half into actually implementing it. One of the things they're finding is people are busy. Providers are pulling their hair out. How do you get 10 people in a 1 to 10 ratio out and about? Or in their case, they have some 1 to 16 ratios. So they broke down their financing that they have all kinds of different groups in their funding. So you could bill 1 on 2, 1 on 3, 1 on 5, 1 on 6. You might like it, but you have to have a lot of business savvy to manage that. But it is a caution. It's an example of you could do some of this in Florida, so maybe some of this idea works. That you'd have different rates for when people are in the building versus when they're out of the building for the service or the quality of ADT. I mean, you could be thinking about this. So it's another example of possibilities of how you might nudge the system forward. We're talking about not stopping today and starting tomorrow with the new picture is, but how do we nudge in incremental ways to get to the next place? You could put an infrastructure in place that would do this, or at least maybe quasi think about how you might break it apart. So then it flips on Minnesota. Yeah, we'll make sure. Yeah. I did this at the last minute thinking about how to spur this conversation this afternoon, so I didn't even, this is the first time David and Kalima are even seeing what I have brought to share with you. Yeah. So this is one thing that we're seeing multiple states do. And look at the bottom bullet there. In Minnesota, and their states, all these states that I'm sharing these examples have approval from CMS to implement this strategy to help convert their, or transform, redesign their system. So I'm only showing you stuff that CMS has already agreed to. So not only is it an idea to try, it's an idea that's been approved to try. So in Minnesota, in their structure, they recognize that a certain age group of folks in their system, because they have a whole lot of folks in their adult training that are hitting that senior age. 55 isn't senior anymore. God, we can't even talk about those of us that are over 65 are seniors anymore. Middle age. We are middle age. So, but it's another component you could put in place that we're not going to disrupt the lives of people that are at this age or have only experienced this environment and this type of service. And they have approved in their state HCBS transition plan that even though they're converting all the rest of their system, those folks can stay in those environments even beyond 2021. They can continue regardless. There's no set end date. For those individuals only. That doesn't mean that all the rest of their systems aren't adjusting to provide different types of service delivery and different ways and assure that youth don't get stuck in these environments that we've created in the past. So it's another option and one that you might want to think about here, particularly given, David, what you said about you have a population that majority of the people in that service are 44, did you say? Yeah. Average is 44. I mean, you're talking about people that have not experienced anything else in life. So we don't want to make them do something that is not really fair to ask them to do. Do we still want to give them opportunities to get out and about and experience life differently? Yes, absolutely. We have to follow through on that commitment of the settings rule. It is about us in the system doing a better job of exploring and exposing people to experiences they've never had before, to learn what they don't know, and for us to learn what we don't know. So it's another option that is something that is possible to put on the table. Now, you don't have this pre-VOC structure, so you don't have to worry about the time limit, but you may want to add that as a service type that falls under that category, so that those folks that need a little more support before they get to VOC Rehab between school, or who are coming out of the facility-based programs that aren't quite ready to jump into that real high-intensity discovery and job search, you might want to add that to your service array as a time-limited, very focused service that helps that additional preparation work, that work trial or work experience or something like that along that line. That's something you don't have in your structure now, but might be helpful.
I just think that would be awesome. There are so many individuals that may never have been given that opportunity, that are in the sheltered workshop ADT setting, who, if they had the opportunity to do some work experiences, to do some industry tours, to do some informational interviewing, who, had a wealth of opportunity, some people that we're saying really don't want to work maybe decide that's an option for them. But it would not limit them to doing nothing. I mean, that's one of my biggest fears when I talk to providers and we talk about making these transitions, is that we need the ADTs to be a very meaningful service, and if 14Cs are going away and that's not going to be an option, which I'm fine with, but I mean, something has to be in there that's really meaningful for individuals. And, I believe it should be employment, but I also believe in choice. But I think people need to have enough experience to make an informed choice. So something of that nature would be really great. And then when they do come to VR, we would be in a better situation to really assist them with that career pathway if they have some experiences to draw upon. Some are, most are not, but some are.
How can we be intentional about those who really need to be in VR as they have connected?
We've had some meetings with APD, and it's been a wonderful conversation, because it used to be if you were referred to VR, and we got you a part-time job, I mean, you really lost out on being able to do any of those other services. And now there's the blend available, so somebody can come to VR, can go through discovery, or even work part-time and still go to ADT some of those other hours. So they, eventually we think they would draw away, but it gives them that support and friendships that they've, been involved in, but they can be both customers.
Oh, I'm aware that they can be both customers. That's not my point at all. My point is, how do we ensure that if a person if a person is a prospective candidate for VR, that they're actually connected with VR? How can we be real intentional about that piece? Because we know that the Agency for Persons with Disabilities does not serve every disability. We serve specific disabilities. So unlike VR, we don't serve as many of the diverse disabilities as VR does. So we're just trying to make sure that if there are people who are sitting in those ADTs who could benefit from the services of VR, that they're getting those services.
And I was just going to make a comment about sort of some of the career exploration or those type of experiential activities. A number of states have found that they're wonderful for folks coming in the front door to get that experience, but they also might be wonderful tools for folks who might be interested in a career change later, or for some of those folks that have been in the system for some time and hadn't explored those pieces. So it really can be a wonderful tool to add to your cachet to make sure that, many of us haven't stayed in a particular career path or with one organization forever. And so thinking about career trajectories in this day and age, it's important to think about helping individuals explore other options and better fit.
Just piggybacking on that point, I think that's so important that we work together, because if a consumer is enrolled with VR but they're having some difficulty in an area, they can come to an ADT temporarily, ADT or however we're going to be called in the future, and we can then strengthen that weakness in employment. So, yeah.
Good, now you're thinking. Oh, I was thinking we have 5 more minutes. So, we have 20 more minutes, I'm fine. Yep. So I was going to bring us back to the questions that I put up before us in the very beginning about, they're at the end. Actually, I put them slides at the end too. So we've had a whole lot of conversations about employment. I'm going to flip us to the next one, and some more conversations about this notion of how do we help people be more engaged in their community outside of their jobs. I think we need, since we have a little more time, can we spend some time thinking about this together? And then we'll talk about next steps, in a second.
Comment. This one I'll probably try not to get irritated about, okay? Because what I've seen in the past, when we talk about community inclusion, we take 5 or 6 people out in the mall together, and we see them sitting on a bench waiting for the bus to pick them up, and they may be in an hour later. So obviously we want people out, we want people involved, but what we've tried to do is community inclusion, I think in many cases has been lacking. I firmly believe it's all about employment, and there's an inherent value of work. So I hope the focus on community inclusion is how people can be involved in their community with some sense of either giving or, giving back and receiving, not just trying to entertain people so we can check off a box if they went on an outing. That's my speech. Okay?
All said. I think anyone not in agreement with that?
I'm totally agreeing with that. We do a couple of things. We do trips to the mall, but we also we did I think last month we took the whole center. We went up to Valdosta Mall, and we provide enough staff on that outing that they can break up into different groups and to go into the stores of their choosing, and then everybody meets back at the food court and then decide what they wanted to eat. And so they still had their choice of the day. But we also have a group that goes out every other week to a local food bank, and they bag food for people who are in need. And then this is a faith-based organization, and they love having our folks come, and so our folks go and meet with other people from that organization, and they bag food all day, and they're always very, very pleased about doing that. I think that's a good opportunity for community involvement.
Indeed, volunteering as a citizen of your community is a good thing and should be encouraged no matter what.
I have a question. I would say, piggyback on Suzanne's point. How do we, and that might be a question for the group, for those of you who are, ADT providers, how do you facilitate, for lack of a better term, community engagement? Where we talk about person-centered planning and that the activity should be centered around what is an individual's interest, how do you do that? Because there's, on the flip side of that, I totally agree with Suzanne. The other challenge I'm hearing from providers we've talked to is that that's really challenging when you have 150 or so individuals at your facility. How do you logistically do that when you're trying to tailor it to an individual's needs? It just sort of that balance act that you have to provide. It might be just a question to consider for our piece.
It's hard, but sometimes we also do it as incentive. If they have been, well behaved, this and that, then we do that. We do one weekly. That's the most that we can do. We do a community inclusion weekly, but we also link it to our academia curriculum. example, Black History Month. They will be taught what Black History Month is all about. And then we will seek an activity within Miami-Dade County that we can then take them to a museum or to a special expo regarding, that topic and many others. Other things that we do, like we take them to the 9/11 operations. We have taken them with City of Miami Police Department, how the canines are taught. We take them to hospitals. If it's, we just try to link it to a monthly awareness message. And that way, it's educational and it is also understanding the community. And yes, we can't take all of them at the same time, but we just take turns. That's the best we can do.
The other way that this is done effectively is through partnership. You have to do it through partnership, and you have to have the only way. And the way you develop partnerships is to have everybody at the table. I mean, there are businesses out here who they are not afraid to hire people with disabilities. They're not. There are so many of them, like for instance that ACE program that I'm telling you about. The employers now call them and ask, do you have someone who will fit this position? Because one of the things that they know, for the most part, is that a person with a disability is going to be very dependable. They're going to show up for work. There's a conscientiousness there that sometimes you don't find in people who don't have the same challenges. So, I mean, it's just through these partnerships with these businesses. And in some cases, when we're out here, and I used to be a provider, when I'm out doing job development, they're not just hiring the person with a disability. They're hiring me. They're trusting what I'm saying. They're trusting what I'm marketing. So, I mean, when you establish those relationships in the community and those partnerships, these employers will open their doors. If they know they can depend on you for what you say you're going to do, and they can depend on that employee for what they say they're going to do, I mean, those opportunities are great out there, and we just have to be real intentional about that and about establishing these necessary partnerships.
I was just going to say that, I guess, to answer that question, I think it is near impossible to have meaningful activities every day without employment being part of it, because what would we all do 7 days a week that is meaningful? Other than eating out and shopping, I mean, literally, and that's what most of our outings do, and they are not meaningful, but we don't even have a mall. So Walmart that's the outing, and it's better than sitting in a day program, but it's not meaningful. But I don't think that's not unique to us. That's life. That, again, what would we all do? I might go to the gym, again, that's a complicated thing with a 1 to 10 group of people, so it's got to be, without employment, I think it's very hard to have meaningful all the time. But the comment I was going to make is I think it is a lot about employers and community agencies and getting them around the table. And for us, we are a smaller community, which is helpful in this area. We have people in the Kiwanis and the Rotary who are telling our stories. And when we did Jobapalooza with VR last year, it was a very low pressure way to get employers to come participate in something. They didn't have to hire anyone. It was almost, they were all excited about it. They wanted to come, and then they started to look around at the students and see their abilities and realize, oh, okay, it made them kind of step out of their, whatever they thought the ARC did, which when they think of the ARC, they think of Down syndrome or someone, with cerebral palsy or something. And so it opened their mind to, oh, I could hire people like this. And that has opened up opportunities. But I think it's not just about educating the people who we serve, but it's definitely about going on a PR mission in our communities to get other people aware.
Okay, thanks. Some of the work that our individual ARC chapters do, and they do a wonderful job in connecting with the community, but they often partner with other community service organizations. So like maybe your local food bank things like that where there's work kinds of activities to do, but it's a volunteer or service learning opportunity. So they could potentially get out there, and those are places that the public comes to and can see our individuals out there who are used to getting the service and support, but now they're put in a position to help somebody else. And so it's very powerful for our people, but it's also very powerful for the community to see them in a new light. So those are the kinds of things in that partnership, because this is a business of sorts, and employers who come out there, other partners of that particular, say, food bank, for an example, get to see the individuals engaged in these work activities. So again, you're moving that forward, but you're engaged in a place where people can interact, because employment, how many of us have that social piece that's work related? Hopefully everybody. You're not changing the desk. Back to work, Bill. No more water for you. Hopefully that's the case, and we should have that kind of expectation for all involved. On a separate note, as we're talking about putting employment together, I was talking to one of our executive directors of an art, Mark Berry, and we were talking about that arguably this is probably the best time to be out there beating the pavement looking for a job, engaging in employment services. But we all know the economy is cyclical. I mean, we might have forgotten, but there was a time a few years back where it was not so good. So as we're designing these services and we're looking to our providers to engage in these employment-related activities, let's keep in mind that cyclical nature of the economy and make sure that we're very deliberate, that as we put together services and supports and activities, that we're not doing it in a way that as the economy changes, all of a sudden our providers are put out because they can't deliver the service that they need to in order to fund the other things that they have to do that are related to pulling in those fees and those dollars that are the focus of some of the things we're talking about today. Thank you, Mark.
Please, you haven't said anything out loud. I think it's time to hear from you.
We just finished our 5th year of Project Search. So we brought up Project Search before, and it's funny that we say that because the new director, and he's from the APD world, he's come in and we've talked about kind of mimicking what we have done with Project Search. And we have invited businesses that would have normally have brought in things for us to do at ADT. Now we are taking those folks to their place of business to work there. And hopefully that's going to mean jobs whenever, at least for some of our folks. And then we've also got a really large art department that we're always out in the community with our artwork. Our people are artists. They get paid for their work. I can't afford their work. I'm sorry, but I can't. They get high pay for their work. And we take them out with the Inspired Choir. We are always in the community. People ask us to come and bring our group. It gets us out there, but it also helps others know about us. And then whenever they do have jobs that need to be done, they will seek us out. We spend a lot of time going out to the community and finding people that we can place. We do have supported employment, supported living, and ADT services. And I'm kind of new to ADT, so when I first got into it, I'm thinking, oh, it's the way you're talking about now. And so that's what we're working towards to make it happen. And I think we can make it happen without having all the extra funding. I do know that funding is part of it, but I think that it's also a way that you can just change the way you do things.
Yeah.
All right, I'll make it quick, I promise. Have any of you heard of Florida Sand or Florida Self-Advocates Network? Anybody? Okay. I want you to write down in your notes right now, flsand.org, okay? There's 16 groups throughout Florida. I'm moving my Panama City group to hear eventually. But I mean, we meet in the community. Most of our groups have monthly meetings, and we all, outside of teaching people about self-advocacy and what their rights are, we have people who are more seasoned advocates that we visit our legislators, and we all have service projects that we do in the community that aren't necessarily disability related. So I can tell you it's very frustrating. I've set up meetings with legislators, and I put flyers in the backpacks of every person that was in the ADT in Bay County. I had 8 people show up for my meeting with one of the legislators. So it's been like pulling teeth. And I understand that you guys want to create opportunities for inclusion, but there are opportunities that already exist for inclusion. You just have to get people there. And, you know, there's a really big group. We have a statewide group of self-advocates that are willing to help. You just have to bring them here and help, you know, help them get to where we are, and we will help you. So if you guys need anything, you can let me know.
Thank you for that. You just took us through what you're going to do. You're going to help keep those connections. We do have to wrap it to start winding down. Oh, I'm sorry. Oh, sorry. Dude, late in the day. We gave you a handout, so we should probably touch on it at least for 2 seconds and then talk about what next. This is a summary of some work you can think about and absorb, but a group of researchers got together with a bunch of different states. This was done through the group called the State Employment Leadership Network. That's another day's conversation, but 25 states got together and spent some time really thinking through what would be the guidepost to help us rethink this support service that gets us to community engagement, to help people really be part of the civic fabric of their communities. And there are 4 primary guideposts. If you open up the sheet in the middle, let me talk about them a little bit, because they are just this. They're the parameters to help think about what do we want to do as we think about going from programs to individualized support. You don't do this one-on-one. You do it with what Amanda said, helping expose people to things they don't know and opportunities that they could be part of that are not the paid support systems. It's really about helping people build friendships and social capital and human capital. And certainly employment helps get that social capital and human capital a jump start for individuals in their lives, but it's part of it. But individualized support for the person doesn't mean we do one-on-one. It means that we think about one person at a time. We help them link to the others that we know or have relationships with that have the same kind of life interests they do, be it paid or unpaid. We think about helping promote them having community membership and offer contribution, having them volunteer and do those food bank, join Habitat for Humanity. That's one of my favorite places to go spend time outside my work life. It's all those kind of things that happen in the communities that it behooves us to identify them and introduce them to people. And it's to ensure that as we move forward, we know what the outcome of work is. It's that brass ring of competitive integrated employment, but we don't know what that brass ring is for individualized community engagement support. We have to figure that out. But we do know from the work that was done in this initial research is that when we set a benchmark or an outcome, we have a goal, and we define that on an individual basis, we can get things done and help them have a better life, a more meaningful life than just going to hang out at Walmart because that's the option in this community. a very, very rural community in South Dakota that I worked with that helped us with this project taught me something. They were a farm that started because a father of a son with autism needed to create something for his son because the system wasn't creating it with him. So he had the resources to buy an incredible amount of land in a very rural part of South Dakota. And when I went there I flew into Albuquerque, and it took me 4.5 hours to drive through nowhere man's land to get to their community. Their community had about 50 people that lived there, and to get to groceries you had to drive an hour. To get gasoline you had to drive an hour, so you always had a gas can in your car truck. So very, very rural is the picture. He started out thinking that he was creating a place for his son to live for the rest of his life, and maybe he'd bring in people with disabilities to live there with him. He's come to a whole new place about it and learned that the rest of the community needed to come together as a community. And so now this place, I'll call it a place, I don't know what else to call it. They're not a farmstead. You would not think of them that way if you went there. If you read about it on paper, you'd think farmstead, you'd think gated community. You go there, it's nothing like that. Everyone in their territory comes and goes together. There are several people with disabilities that live on this land now, and there's more people without disabilities that now live on this land. They've built housing together. They use Habitat for Humanity resources, so people came from far away to come there to build some housing structures that didn't exist. And they share resources. It's a ranching farming world out there. So now I know his son in particular now drives a tractor. No one would have ever imagined his safety on driving a tractor, but he has learned to drive a tractor to cut for hay. He's not good with a baler, but he can drive a tractor to do some cutting. But it's a story of how we have to not think within what we know. And they have brought in the whole community. That the family was able to finance building a commercial kitchen on this property. And everyone, all these other farmers, now use the commercial kitchen just to come and prepare and sell their garden produce. And they now have an enterprise, and their whole community has become wealthier, and their status has improved. Some of the older guys go down to the one gas station that's an hour away, and they play checkers and backgammon and cards once a week. So it's both the people with disabilities. I think there's only about 8 people with disabilities that live in this whole territory. But now they have a place to go together. They don't all go there. Not all the people with disabilities go there. And not all of the folks that live there ever had the experience of joining with their other neighbors who were 15 miles away. So it's another way to think about beyond what we know is possible in rural communities. So want to keep us reminding that. So one of this endpoint is what's goal-oriented for the individual and what's goal-oriented for the community. So today is the start of not just talking about this, but taking some of these strategies and then working through developing a work plan that breaks down what are the activities we have to get there. What does APD need to do to add new service options within the adult training structure? How long will that take? How many people could shift? When could you close the front door to traditional services? What are the ages of people that you want to think about in that transition? This is going to take a lot of spreadsheets. David's good at data. I've discovered he can analyze your information here in a way that we don't often see in state staff. So Just forget it, David. You're not going yet. Yeah, David has shared with me that he really likes exploring foods he's never tasted before. But anyway, I hope that today, the morning, and this afternoon is the beginning of your adventure of not just being stuck in the misaligned Florida funding structures, because that just is. It's got to be fixed. It's going to take time. But how do we begin to change the things we can change so we can get to the funding piece of it? How do we make sure the legislators know what you need in a way that you can demonstrate what's possible? And you're going to have to take some risk at all levels, both individual commitment and group commitment. We've got to figure out some better communication strategies. And thank you, Amanda, for all the work you do at SANS and the grassroots work. We are going to take you up on helping us get the message out to people. So appreciate that.
Okay, so real quick, so for the immediate after this discussion, next week we're going to compile the feedback we've gotten. Elizabeth has the information from the WebEx comments that we're going to pull together, and then be able to provide you all a summary. Then we will follow up with you about next time for this working group to meet, because at least for the first few months, we would like to meet periodically to start developing that plan that Ree's talking about. And then probably, I would say by September, we'll reassess to see what sort of more of the long-term goals that we want to be able to implement, working with each of our stakeholders. So with that, I will be in touch with all of you next week. If you have not signed in, please do that so that we have your email addresses so I can follow up with you. With that, thank you all for being here. Anything else I missed, Kalima? Okay, that's it. Thank you very much.